I had a great childhood. My mom stayed home, so I was spoiled. My dad, of course, went to work and every day and to some magical place that I knew I wanted to go someday, and I now know it's work. Once we lived here, I got to know my neighbor. She had 2 small kids, and she was at nursing school at BC, and she talked about nursing and what it was to work at actually KMC. And she was a critical care nurse, and she loved taking care of patients. She made it sound exciting, and I was not thinking about nursing at all. And so she was such an influencer on my life that I actually graduated a year early so I can go to Bakersfield College and become a nurse that much faster. My first job in nursing was at San Joaquin Community Hospital. I was a critical care nurse there. I think I loved the excitement of taking care of patients that were so ill. And then I love my coworkers. You really get to know them a little bit more because you work in such a small area, and critical care is a lot about teamwork. And I knew if I wanted to advance beyond just the bedside nurse into a leadership position, that I would need my bachelor's as kind of the entry level. And I also wanted to make sure that I knew everything I needed to know to take care of patients and to do it well. I worked every weekend for 2 years just so I can get my bachelor's, of course, from Cal State. It was a great program, great experience.
The thing that Terri that I learned the most about taking care of patients was the fact that she modeled the nurse that you would want to be. Always had the patient first and foremost in her mind, and also as a nurse, learning, really showing how to be a patient advocate, and always treating everybody with respect, compassion, integrity, and kindness.
I went into nursing administration by accident. Actually, I was, by that time, I was already in leadership doing care coordination or case management. So I've been here 13 years now, and very, very proud of our hospital and all the programs that we've been able to advance, and I've been able to help with those. I think what I'm most proud about, really 2 programs. One, our pediatric program. Before, when my kids were little, if they needed any type of care at all for hospitalization, you had to go to Fresno or to LA. And we knew that we wanted to change that for our community. We have some great community support. So it's the Lawrence Small Children's Center. And so with that, we have general pediatrics, which the Bolthouse family was able to help sponsor part of that. And then most recently opened our ED pavilion. Again, the Grimm family helped us with that. So it's been nice to have all this community support from multiple families to really grow a program. And of course, we're still growing that all the time, but I'm very proud of that.
I think it's important, and I'm really happy to see that Cal State Bakersfield is recognizing a nurse, especially Terri, as an exceptional nurse to the Hall of Fame. Nursing has been at the heart of this, taking care of the patients that have suffered with COVID in our community, and the nurses are very worn out and they're tired, and but she's encouraging to them, making sure that they have the resources that they need at their fingertips, and really listening to them, spending time with their nurses, and encouraging them to express how they feel about this very unfortunate pandemic that we're still enduring.
I just feel like come to work and do my job and try to take care of nurses and patients, and so what an honor to do your job and someone is, acknowledging you for it. And so thank you very much, Cal State.